Good evening. Some Randolph County families are making new plans after Moberly Regional Medical Center announced it will close its labor and delivery unit June 1st.
KRCG 13's Juliette Dreyer spoke with a local hospital that did the same thing 2 years ago. She joins us live in the studio. Juliette, can you tell us why Callaway Community Hospital closed their labor and delivery unit?
Teresa, it mostly came down to money. The chief operating officer at Callaway Community told me the labor and delivery units cost a lot to operate and they weren't getting the numbers into the unit to make it sustainable.
We had dropped below 50 babies a year in our unit when we closed it down. That was just not a viable service for the hospital.
Callaway Community Hospital closed its labor and delivery unit in March 2012. It's that same kind of decline in numbers that led Moberly to shutter their unit next month. Out of the 1,100 babies delivered to Moberly families in 2013, just 167 were delivered at Moberly Regional Medical Center. At Callaway Community, Chuck Baker says the declining numbers could be attributed to people choosing larger healthcare systems.
That's probably due to the fact that the standard seems to be here now today that people want to have their babies delivered by an OBGYN. In a small rural hospital like us, that's a hard expense to take on, paying for an OBGYN, and we just could not afford it. So our deliveries were done by family practice physicians.
But fewer labor and delivery units means longer drives for pregnant women. While Baker says Callaway Community Hospital can handle imminent deliveries and emergencies, there are some things that they cannot do.
We don't have the ability to do 24-hour C-sections here. If something happens in the middle of labor that the mom would need a C-section, then we don't have a surgeon on call here that can perform those. So that determination has to be made ahead of time by the physician and the nursing staff in our emergency room.
In those cases, the hospital can try to arrange a transport to the closest suitable health center. And we want to know if you know someone who's been impacted by a small hospital's delivery unit closing. Do you think it could be a health risk to pregnant women? You can join that conversation on our Facebook page.